From Penn State Health, this is Ask Us Anything About Bone and Joint Injuries in Children. I'm Scott Gilbert. Whether it's playing around the neighborhood or playing their favorite sport, there are plenty of opportunities for kids to get injured just by being kids. Today, we're going to get your questions answered about bone and joint injuries in children by Dr. Joseph Petfield. He's a pediatric orthopedic surgeon at Penn State Health Children's Hospital. So, Dr. Petfield, great to have you with us today. You know, I'm curious, as we age, it seems that many bone and joint injuries are caused or at least aided by the aging process, speaking somewhat from experience here, and degenerative conditions, that kind of thing. But what are the most common types and causes of orthopedic injuries in children and people we think of as young and healthy?
So that's a complicated question. I think you can kind of divide it based on the child's age. So I would say in school-age children or children who are more typically doing things like playing on the playground, it's typically broken elbows, broken wrists, something like a fall from a trampoline, some type of upper extremity injury, or sometimes broken shin bone. I would say in children who are a little bit older, adolescents, it's more sports-related type injuries. So some type of knee injury if they play soccer or football, upper extremity, shoulder injury, and then typically shoulder and elbow injuries for baseball players.
Yeah, and because they're still developing, are there certain body parts in children that are especially susceptible to injury?
Yes, of course. So I would say in younger children, typically the elbow and the wrist, and the growth plates that they have to allow their bones to grow serve as a point of weakness where the bones can break more easily. And then I would say in older children, kind of type a similar thing, fractures around the growth plates.
Now, you know, we hear that term growth plate injury with young athletes sometimes. I mean, my son's a pitcher. He had one back in Little League. What are growth plates and where are they in the body and how susceptible are they to injury?
Well, can I grab a model bone and show you?
Oh, that would be great. Yeah.
Well,
Yeah, if you have a model. You brought props, folks. This is always helpful. I love it.
So this is an adult bone. This is a femur, which you can see here. And so in children, at the top and the bottom of the bone, there is typically a small stripe of cartilage. So in the femur, it would be about right here. And what that does is it allows the bone to continue to grow down and up. And that's what allows bones to have their growth over time. And that cartilage, as it continues to grow, slowly turns into bone and increases the length of the bone. And that's important in injuries for children because if you have a damaged growth plate, that can potentially lead to long-term consequences. And that's why I think seeing somebody like a pediatric specialist is important when a child has a growth plate injury, because not everyone would be as cognizant or paying attention to the potential for growth issues in the future.
Sure. You're watching Ask Us Anything About Bone and Joint Injuries in Children. I'm Scott Gilbert alongside Dr. Joseph Petfield, who welcomes your questions, your comments. Just add those to the comment field below this Facebook post, and we'll get to as many questions as we can here in the time that we have for this interview. And even if you're watching this on playback, feel free to add your questions, and we'll get you a written response. You know, you mentioned a couple of the more commonly broken bones are in the shoulder. I think the upper arm, I think I heard, is it the femur is another one. I'm curious, what makes some of these more commonly injured in children versus others? Is it just the nature of the kind of stuff that they do?
I think those injuries being common are, one, because of specific activities that children do, like playing on the monkey bars and falling out with their arms stretched out like this, or falling on their wrist and trying to fall from their bike and protect themselves. And those type of typical injuries occur at known locations in the bone where the growth plate is thick or there's some type of specific weakness of the bone. So for example, a very common injury in elbows, like a fall from the monkey bars, is a supracondylar fracture of the humerus, which is right here in your arm, because that's a spot of significant growth where there's a weak growth plate.
How often do bone injuries, bone fractures require just simple casting versus something more serious like surgery? And kind of what are the factors that determine the course of treatment there?
I would say if you look at all broken bones in children in general, most of them can be treated without surgery, particularly if they do not involve a joint like the elbow or the shoulder. And one of the reasons why they're treated less frequently with surgery than adults is because children have a lot of growth remaining. Their ability to heal is exceptional. And so that allows us to be able to treat a lot of injuries that we would treat with surgery in an adult just with a cast. If you look at all comers, we probably treat 80 to 90% of the injuries that come to us with casts.
And again, why are children so good at healing? What is it about the young body that makes like broken bones heal better than they do in folks of, say, my age?
I think it's just their exceptional growth potential. The bones have a really thick covering on the outside of them called periosteum. It's almost like a skin that covers the bone. And in children, the periosteum is so much thicker than in adults, and the blood supply is so great that it just stimulates a very robust healing response. And I think that's one of the things that allows children to heal so quickly.
All right, a lot of good stuff there about bones, and we can certainly take more questions if the audience has questions about those. I'd like to shift to sprains and strains because those are other really common injuries. What is the difference between a sprain and a strain? Those two words, they sound so similar. I feel like they're easy to confuse.
Sure. So a sprain is an injury to a ligament that keeps the joint stable. So for example, a common one is a sprained ankle. Whereas a strain is typically something that involves a muscle. So say someone is doing a sprint and the muscle contracts very hard and quickly, like your calf muscle. You can strain your calf muscle. You typically sprain your ankle. Now, I will add that strains are very uncommon in children under about 12 years old. And the reason why is because the ligaments are actually stronger than the bones. So it's much more common for a child to break their bone around the ankle than it would be for them to sprain their ankle. A sprained ankle in a child less than 11 years old is very uncommon.
In terms of severity, I know all of them have varying degrees of severity, but in general, are sprains or strains, is one worse than the other generally?
It really depends on how bad the sprain or strain is. So there can be mild sprains and there could be severe strains. The treatment is really based dependent on how severe it is. But like I said, strains are very uncommon in children, and because they more often break their bone than they do sprain an ankle or something like that, it actually allows them to heal better and return to function faster, because bone heals much faster than an injured ligament.
Very interesting. You're watching Ask Us Anything about bone and joint injuries in children. Dr. Joseph Petfield is a pediatric orthopedic surgeon. He knows his stuff about bones and ligaments and tendons and sprains and strains, and we welcome your questions. Just add them to the comment field below this Facebook post, and we'll get to as many questions as we can in the time that we have. What are the most common joint injuries in children?
So I would say joint injuries are more common in adolescents who are kind of closer to becoming adults, and they place more stress on their joints, like, for example, playing soccer, basketball, something like that. I would say the most common is probably an injury to the anterior cruciate ligament, the ACL, which is a common, if you watch professional football or professional basketball, you probably heard about that. That's a knee injury that happens during some type of pivoting motion and typically requires a surgery to reconstruct it. I would say the second most common in children is typically a dislocation of the kneecap. And that occurs in children just because their ligaments are a little bit more stretchy than others. We often try to treat that without surgery at first, but sometimes if we're unsuccessful, we will require surgery in the future.
And because sometimes I know some people wear a knee brace, right, to try to get that knee to kind of re-fix, I guess, on there.
Exactly. Yeah, there's different types of knee braces that we use for different purposes, which is all the more reason, if you have a knee injury, to come in and see us and not just consider buying one off the shelf, because different knee braces work for different reasons.
I apologize. You might hear my dog barking. He knows what's speaking back there. I was just going to ask you about dislocations. You mentioned knees. I'm sure that's very common. Anything else, any other parts of the body where dislocations are common, especially in, as you mentioned, adolescent athletes?
Similar to like what I said before, dislocations in children under 12 are extremely uncommon. And the reason why is to dislocate something, you typically have to tear a ligament. And so in children that are not adolescents, it's much more common to have a fracture. And if it's a really severe injury, a fracture and a dislocation at the same time. As children get older and they're kind of transitioning to adults, then we start seeing adult pattern injuries, like in football or rugby players, we see shoulder dislocations. In, I would say, older adolescent baseball players or softball players, we start to see some ligament injuries on the inside of the elbow.
Mm-hmm. And that's kind of where I was going next, and that is overuse injuries, because some of those ligaments can be damaged by overuse by, say, again, I have a bias here, but youth pitchers and other types of things. How prevalent are overuse injuries among children? And I mean, are they becoming more common as time goes on?
They are most definitely becoming more common, and I think that reflects the competitive nature of children and how year-round sports are becoming much more common these days. And so that typically just happens because if you do a single type of motion for a long amount of time, the bone and the ligaments in that area are going to fatigue. And so some things you can do to minimize overuse injuries are make sure that your child, or you, if you're an adolescent listening to this, have some type of off season, because your body needs a few months to recover if you are continually stressing it. So for pitchers, for example, you need to have a period of time where you are not pitching to allow your body to heal. In addition to that, if you have a child who plays baseball or gymnastics, a lot of the national academies like the Little League Association of America make sure that you are following their guidelines. So if you go to the Little League website, there is a number for how many pitches can be thrown based on the age of your child. And you are putting your child at risk if you do not obey those numbers. And I've seen it in clinic. Another thing that you need to do is make sure that your child is getting enough vitamin D. And vitamin D is something that's critical for the bone to heal and be resilient. And if you look at the data, around 30 to 40% of Americans are deficient or have low-level deficiency in vitamin D. So I take vitamin D. I give my kids vitamin D, and I think it's a useful thing for people to know.
Yeah. So is that something that they can usually get a sufficient dose of in a multivitamin, or are you recommending a supplement possibly even beyond that?
It really depends on which multivitamin you're taking. And if you Google the website Ortho Kids and vitamin D, that's from the Pediatric Orthopedic Society of North America. There's about a 2-page article that you can read about vitamin D and how much your child should be taking based on their age. It also explains how vitamin D works and why it's important.
You're watching Ask Us Anything About Bone and Joint Injuries in Children. I'm Scott Gilbert, joined today by Dr. Joseph Petfield. He's a pediatric orthopedic surgeon at Penn State Health Children's Hospital, and we welcome your questions for him. And also, if you find this information helpful, as we hope you do, we hope you'll share this Facebook post so others on your feed can take part in the great information that we're sharing today. I imagine there are some injuries where people are wondering, can this be treated at home, or do we need to get medical attention? And I'm sure there's some where it's pretty obvious one way or the other, something rather minor versus something like an obvious compound fracture. But then there are those injuries in the middle. Any advice for people in terms of, when to possibly seek medical treatment, and when that treatment should take the form of, just say, the next day at the doctor's office versus maybe an urgent care or an ED right now?
So I would say reasons to go to the emergency department: if there's gross deformity, if your child fell up from the playground or something like that, arm is bent, really crooked, some type of problem, then I think that is probably where you should go to the emergency department right away, or an urgent care. Another thing where it really depends on your judgment whether to go to the emergency department at night or wait till the next morning is someone who's refusing to bear weight. So children typically, especially younger children, they don't really fake things. And so if your child is persistently refusing to put weight on their leg after some type of injury, that's a reason to go get it checked out. Now, whether that be in our orthopedic clinic where we have acute appointments every day, or whether that be in an urgent care, your pediatrician, or an emergency department, it really depends on your level of concern. But it's something that needs to be looked into, because children will typically not fake limping around for a prolonged period of time.
That's a great point. What about use of ice or heat on an injury? It seems like some injuries are good for one, whereas others require the other, right?
Yeah, so that's a complicated topic, but I would say in general, if you have some type of injury where there is swelling, we typically recommend ice, and because the ice allows, it constricts the blood vessels in that area, and it allows the swelling to go down. If there's some type of chronic muscular strain, I would say this is less common in children, more common in adults. heat is more effective in those areas.
Right. When we talk about injuries that damage a bone, a muscle, a ligament, or a tendon, how important is it to ensure that the injury won't re-aggravate or happen again, especially in the near future?
So I would say the biggest thing, especially if you have a teenager who plays sports, is if your child has some type of overuse injury, make sure that they have an adequate amount of rest where they can appropriately heal the injury. And in these days of competitive sports where people have travel tournaments and everything like that, there's a lot of pressure to get people back to playing right away. And typically when those people come to talk to me in the office, I tell them that they almost need to treat their child as if they were some type of professional athlete. If you have a professional athlete who's looking to prolong their career for the next 10 to 15 years, they're not going to really worry about getting, unless it's like some type of national championship game where they'll never play it again in their life. They're not going to worry about getting back to that next game right away because they're concerned more about the longevity of their career. And I think that is also can be applied to children who want to get back to sports as soon as possible. Is that they really need to take that time and invest it, because if they go back before they're fully healed, they're just setting themselves up for a re-injury in the future.
And I bet those discussions about return to play, can those be difficult, especially because when you're talking with parents and athletes about that, it might involve news that they don't want to hear?
Kind of like I said, it can be difficult. One of the things we're aided by in medicine today is we use a lot of objective criteria for return to play. And so if somebody has an injured extremity, like they injured their knee, for example, we can now test the knee, the strength, how far you can jump, things like that, and compare it to the knee that's not injured. And so I usually use a cutoff of 85%, that your injured knee needs to be performing at 85% the capacity of the non-injured knee. And so that way it takes quite a bit of the discussion and debate out of it, because there's evidence that shows if you don't return to that level, that you're setting yourself up for a problem. Now, that still is a difficult discussion to have, but I think, when people are able to look at the numbers and it gives them a goal to shoot for, it kind of makes them a little bit more determined to get back to play in the future.
It sounds like what you're saying, though, too, is that there are injuries that can happen even early in childhood that could create problems later in life if they don't heal properly, correct?
Oh, yeah, that's completely true. So if there's, for example, a fracture that involves the growth plate, very rarely you can have an injury to the growth plate where a part of that cartilage turns into bone and then the growth plate stops growing in a certain area. And so that can lead to issues with the way that the bones are formed in the future. And so I think, for example, those children that we see where they have a growth plate injury of their wrist or a growth plate injury of their ankle, we will typically watch them intermittently in our office for up to a year to make sure that they are growing appropriately and that injury has not happened.
Are there ever cases where what seems at first to be maybe a routine bone or joint injury leads to the discovery of an underlying bone disease or disorder?
That can be the case. Things like infections, stress fractures. People typically think, oh, I bumped into someone while I was playing soccer or something like that. But what I would tell patients and their parents is that it's probably, if you're having persistent pain after a couple of days, you should probably have it checked out, because playing through the pain, if it is true pain, you're either going to potentially make yourself worse, or there could be some type of underlying issue that you're missing.
Yeah, and playing through the pain, I think that's a really important thing, because sometimes there are many different sports, where children can feel pressured to do so, because in the moment they might think, well, I'll just soldier through because that's the strong thing to do, but that may not be the best idea for long-term health, right?
Yeah, I completely agree. And if you look at children who play gymnastics, basketball, baseball, all of these sports that are associated with overuse injuries, cross-country running, you're looking at someone who has the entirety of the rest of their life when they're 11, 12, 13, 14, 15 years old. And so you really, some type of injury while the bone or the joint is still developing can cause some significant problems in the future. So I think it's really important that we pay attention to those injuries now.
As a surgeon, what are some of the most common procedures you find yourself in the OR for, especially, again, with younger folks and their injuries?
With younger folks and sport injuries, I would say most commonly pediatric elbow fractures, The reason why we operate on elbow fractures much more commonly than something like a wrist or a shoulder is because a lot of the growth of your upper extremity, sorry, I put my arm in the picture here. A lot of your growth comes from this part of the bone down by your wrist, and a lot of it comes from your shoulder. The growth plates up by the elbow grow much more slowly. And so what that means is that there's limited healing capability there, where if the bone is not aligned right, it won't be able to correct itself over time. And so that's why we have to correct those bones and their alignment with surgery, which is much more common for those areas. So typically elbows and elbows is the most common thing, elbows and ankles.
Great advice today, Dr. Petfield. We appreciate your time sharing both about how to keep kids safe and healthy and how to get them healthy again after an injury. And in fact, we'll share a link in the comment section below this Facebook post to some more information should you want to contact Dr. Petfield or somebody else in his clinic. Dr. Joseph Petfield, thanks so much for your time today. And we want to thank you for watching Ask Us Anything About Bone and Joint Injuries in Children from Penn State Health.